Black doctor stands up for black women, gets passed up for promotion, now sues. According to his narrative, let's put him up. He's well known to be a strong advocate for equity in medicine. Dr. Stanley Berry, impassioned Detroit physician, providing to women with high risk pregnancies for over 37 years, is now suing his School of Medicine, Wayne State University. Why is he suing Wayne State University? Let's go down the list. First, in 2020, I want you to know Berry, this good, great doctor, highly respected, was highlighted by Time for his courageous work, choosing the front line during coronavirus over his planned retirement. He told the Time, the bravest people that I know in my lifetime, Meg Evers, Malcolm X, and Martin Luther King Jr., all knew that they were going to die. They went ahead and did it anyway. I don't want to die, and I'm not in this to be a hero. But medicine's been good to me, and the city of Detroit's been good to me, and we're being clobbered right now. My will is made. So I'm just going to try to follow all the guidelines for wearing personal protective equipment and help. The man was in retirement. Legacy of a medical doctor will be celebrated by colleagues in the medical professional for generations. He was also older than many. He was more vulnerable to the height of COVID. Instead of staying in the background, he decided to go in the foreground and help put his own self at risk. He said, I have already written my will. I don't want to die, but I can't sit back and do nothing. This is the kind of heart you're dealing with. I want you to understand the soul of this man. After lockdowns, Dr. Berry opted to continue working, now using his voice to provide justice for women facing racial discrimination in healthcare, something we've talked about many times on Indisputable. In the winter of 2022, Dr. Stanley Berry says he tried to raise a very serious issue with his colleagues at Wayne State University's medical school. Bias against black patients in healthcare, especially when they report pain. A particular concern of the veteran doctor was residents potentially harming pregnant black women without realizing it by sending them home despite their excruciating pain, which he said happened at least once. So let me explain what he's talking about. Now, he's using an actual situation there at the university, at the medical school, okay? But there is macro data that has been presented, has been provided, has been echoed by those on the left and the right, okay? The first time I heard this data was at Morehouse School of Medicine in Atlanta, Georgia. I lectured there in the summertime. And there was a presentation about all of these inequities as it relates to healthcare. And what did we find? We found that black women were not believed. We found that there were issues connected to pregnancies where black women said there's a problem and the white doctor did not take it seriously. And we saw the gap. We saw the disparities as it relates to race in that presentation. There's more. Berry's colleague also noted discrimination. Executive Vice Chair of the department, Dr. Lynetta Coleman, told Berry she saw how a resident engaged a black patient with a history of preterm birth at DMC Sinai Grace Hospital. Coleman pointed to this incident as an example of how unrecognized bias can adversely affect patient care and clinical outcomes. This is all very scientific. These things are not abnormal, all right? Everyone has bias. Everybody has implicit bias. It is not evil to have implicit bias. It is just wrong when you refuse to check it. All right. We process 11 million unconscious thoughts a day. Only 40,000 of them become conscious. We are walking around in a stew of bias, implicit or intentional. There's more. Berry followed up with another memo that day. All right. Same day, calling for a meeting on the issue. Hey, let's meet about it. In my 38 years of working and teaching trainees, I understand that mistakes are made every day by everybody. And when these mistakes pose a real danger to patients, they need to be discussed openly, honestly, and in a timely manner. Berry wrote, I am disappointed that some of you consider my urgent effort to end this substandard medical practice is in poor taste. He was correct. His meeting was canceled by a higher up, and a separate meeting was called, excluding the professor. The complaint states it was in this meeting that he and Coleman were referred to as bad apples, and Dr. Coleman had a history of hostility. Despite serving as the interim chair of the department, remember, interim chair is the person that's going to be chair. That's how it works typically in medicine. And applying to fill the position full time, Dr. Berry, who'd served a combined 3 decades as part of the Wayne State faculty, says he was skipped over by the university's administration for a white and less qualified candidate. Dr. Berry has filed civil rights lawsuits alleging he was discriminated against because he spoke out about the dangerous racial bias projected onto Black patients in healthcare. I actually agree, Dr. Berry. Dr. Berry's proclamations correspond with what the American Society of Anesthesiologists say is the most up-to-date and extensive study. So let me give it to you. According to the study, Black women, this is what the doctor got passed up for saying, basically. Black women have a 53% increased risk of dying in the hospital during childbirth, no matter their income level, type of insurance, or other social determinants of health, suggesting systemic racism seriously impacts maternal health, according to an 11-year analysis of more than 9 million deliveries in the United States and our hospitals. This was presented at the 2022 annual meeting. The doc was right. He was on to something. What he said was true. They couldn't handle it. You see, this concept that in order to be promoted, in order to be effective at your job in certain arenas, you must be the agreeable Negro to remain in place. 38 years, a man who's willing to sacrifice his own life in order to save members of the community he has never met, not get paid a dime for it, just wants to be helpful. The kind of man you want serving next to you. You want that man in your organization because at the end of the day, he protects you. Not only does he support the ultimate agenda and value the patients, he protects the entity by calling out the madness that is about to bring you down. What does he get? He gets passed up. All right, we will follow this case. Yasmin, thoughts here?
Yeah, the medical system in this country is problematic. It's bogged down by bureaucracy, and there are too many private interests interfering with the ability of doctors to provide healthcare to individuals. And included in all of that, there are disparities that doctors and hospital systems need to be aware of because they impact the access to and quality of healthcare that certain individuals receive. And that's whether we're talking about a wealth disparity, a racial bias, et cetera. And as you mentioned, those disparities have tangible and critical results sometimes. And I'm not condemning doctors or hospital workers here. A lot of times their hands are tied as far as what kind of care they're able or allowed to provide to people. They have to work within systems that don't always prioritize the health and well-being of patients, ironically, instead prioritizing, for instance, hospital politics or profitability. And the doctors that I know personally do their best to work within those systems to provide good care to their patients. And a lot of doctors, including some that I know personally, are advocates for better hospital protocols and conditions. And included within that advocacy, they attempt to raise awareness for racial biases, and they attempt to update outdated medical beliefs and practices, of which there are many. This doctor wasn't unusual in his advocacy. These types of disparities are well known. They're taught in higher education institutions. You can get an advanced degree in this stuff. Dr. Berry never should have been treated this way. There's no excuse for any of this.